One of the most common things which parents will find that the children frequently faces will be cough and cold.
Yes.
So even in cough and cold, it can just be something very minor, like just a viral infection which is causing this.
Absolutely.
If it is bacterial, it can of course turn out to be serious. But one of the most common causes will be pneumonia. So having said that, just having a cough and cold can also worsen to a very serious degree, and it can have its complications.
Absolutely.
So difficulty in breathing is what we would normally say is the danger sign that we look out for. The cause can be pneumonia, it can be infection in any part of the body, or because this is how children will present themselves.
Absolutely.
Or it can be because of probably some allergic reactions. There can be multiple causes. If it's a very small baby, it could be because of an underlying heart problem.
I see.
So this is what your difficulty in breathing would be. Second, we could say would be unconsciousness, lethargy. So how do we see that this child is sleeping too much? They must have just started with cough and cold, having difficulty in breathing, fast breathing. They are having something we called as chest indrawing. They have all these symptoms, but it gradually worsens and the child starts sleeping too much, sleeping most of the day. Further on, not responding when we are calling out to them. So this can be because of, again, respiratory infections. It can be because of some underlying, any infection in the body, because of diarrhea, causing severe dehydration. So also, if they have some, we can say brain fever, which they must have caught on some way, or if they can have, or if they have probably had a fall. So there will be a lot of associated symptoms also along with this, and there will be signs. So this is so just basic. If you find the child sleeping too much, that is also a cause of worry, not arousable. In the sense, you call them, you will know the behavior of the child.
Absolutely.
So not waking up or being very irritable, wanting to sleep, not responding properly. These are that's one of the second important cause. The third we could say will be having diarrhea, loose stools. Now this is the climate where they can develop profuse loose stools, and parents will think that it is fine, but we have to concentrate on the frequency. How bad is it? Is it like profuse watery, just water, babies just passing water? And if it is associated with blood or mucus, so it can be because of dysentery. So all these causes become very important. Why? Because this can lead to dehydration.
Absolutely.
Now that is something very serious in children, because they rapidly lose the body volume, the body fluids in their body, because of their high surface area. So this is another thing that parents have to be aware. Caregivers have to be totally on their alert, like how is a child responding, behavior, very important. The third we could say will be fever. Now a child having, the interesting thing is in small children, high fever or being cold, that means hypothermia or hyperthermia, both are significant. So in a child, we will say when a temperature is more than 100 degrees Fahrenheit, or 37.7 degrees, that is significant. So then what we need to do is, you need to first do your cooling measures, which I'll come to. But also having a temperature which is less than, say, 36.6 is also very significant, especially in the small infants, in the neonatal period also. Why? Because hypothermia is also a cause for infection. So that is how they will just be cold. Their body will be cold. Hands and feet will be cold in small babies. That is very significant. High temperature in children more than 1 year, 2 years, and if the temperature is going very high, so also in the infancy, this can be associated with seizures, which happens quite a few times, especially if they have a genetic predisposition, or if this can just be a sporadic cause. So they will come with abnormal movements or seizures, sometimes which might stop in probably 5 to 10 minutes. Sometimes it can be prolonged, and it can keep occurring again and again in this age group between 6 months to 6 years. So this is also significant. So this is also something that they have to look out for when you have high fever. The other thing will be, like I said, convulsions. So the convulsions, the fits that they have can be because of febrile, just a febrile seizure, which has happened because of some underlying infection which is there, or if there is a meningitis or a brain fever, like how I have said, then the child will continue to have seizures. So this is something very important. Also, we have to look out for seizures which are associated with fever and which is not associated with fever. So like we have your provoked and unprovoked fevers, seizures. So that is like very important. So if parents are aware of what they have to look out for, that is very important.
Correct.
Also, another important thing is that in small children, seizures don't always present like how they do in adults. So what happens is in adults, we have a typical stiffening and jerky movements, how we will say in very simple terms. So in small children, they can present as that also, or they can, in small babies, they can just have blank staring movements. They'll just be staring, and you know that they are not in that space. They are not present at that moment. They'll just be staring at you for a couple of minutes or seconds. Or they might be just having some cyclical movements of their legs or hands, or just some abnormal movements, some orofacial movements, like they might be just having some lip smacking movements or some chewing kind of a movement they might have, or they might just be having some irritability. Not sleeping at night, irritability, a very shrill cry, which parents will understand this is something different. A normally well child who is very irritable, not being able to be consoled, crying incessantly, that is something very significant. So that is something that we need to look out for. Also, jaundice, now that the climate is the monsoon season, there will be a lot of waterborne infections that you can have, so like your hepatitis, etc. So that is significant. Again, when they become too yellow, you'll have an idea. They'll have all your vomiting complaints. They'll have complaints of not losing appetite. And an important thing of jaundice in small babies will be, which can be which is not an infection in small babies. In them, after around 1 week to 2 weeks, if a jaundice persists in a small baby, now that will be significant, because that becomes more of a pathological jaundice is what we say. And then we have to see whether it is increasing. If you see it on the palms and soles, if they're looking very yellow, we have to see the color of their urine. How is the color of their stools? If it is white, significant, that can be something like an obstructive or a cholestatic jaundice. If it is a typical kind like biliary atresia, they need to be operated immediately. So those are the things that you look out for. Second thing is when we have persistent vomiting, not able to drink, and they are not able to keep down anything that they're having, whether it is food, liquid, anything. So that now in the different age groups. Now if it is a small baby, after every feeds, they might have a little bit of regurgitation. We won't call that vomiting. That by spacing of the feeds and by burping appropriately, it improves. But in an older child who is not able to keep down anything that they are having, now that becomes significant. So in that reason, we have to see like, are they getting dehydrated again? The same way we speak about loose stools. If it is associated with fever, continuously, persistently, then we need to take medical advice. If the child is not having any fever, but there is vomiting, greenish color vomiting we say, or there is some abdominal distension, like we say portfugle kind of a thing. So in that case, then they have to come and show, because this can be some intestinal obstruction.
Absolutely.
So this now becomes significant. So in children, we need to know the color, the amount, what are the contents of either it is a stool or of a vomitus. That is very important for us.